Just going to give it one more minute. Thank you all for joining and welcome to the Equity Exchange event, leveraging AI to improve inclusion in research and equity in health. Just to start off, we wanted to also celebrate and mark the gallery's sixth birthday, and just wanted to have a very few couple of minutes just talking about what we've done over the past 6 years and just sort of celebrate with all the lovely people who are here on the call with us. So, just for people who may not have seen us or worked with us before, we connect underserved communities and pharmaceutical companies to improve inclusion in research. So, sort of holding underserved communities at the center of what we do, getting true to life insights and creative communications, as well as connecting people within their communities, valuing lived experience where it's often either overlooked or unheard. So we sort of do that with insights and outreach, insights which are very often overlooked in the pharmaceutical and clinical trial system, where decision making often does not account for lived realities, true to life insights of different people living from different backgrounds, and reaching all of these wonderful people in different communities that we work so closely with through our wonderful, amazing community partner network. So just a small little sort of, moment for all of us to be proud of and of about what we've done at Egality. Over the past 6 years, we've delivered 57 projects with 40 clients across 32 medical conditions and represented 12 underserved groups, especially groups that are often not even counted or are not even sort of part of a lot of data capturing processes like Latin American communities. This has also helped us share funding and funnel funding towards community organizations, networks, small businesses, and individual health advocates, upwards of £430,000, which we're really, really happy for and proud of because that's something that we really pride ourselves on to be able to really share the kind of work we do and the kind of funding we get with all of our amazing networks and partners. We've gathered more than 100 trial recommendations from patients and caregivers through 108 hours of insights gathering sessions with more than 130 participants across 10 geographies. It's been painstaking and absolutely brilliant in the way of sort of just working through lived experience and working through sort of really hectic, messy, but amazingly rich insights to be able to develop these recommendations for different clinical trials. Our outreach has engaged more than 11,000 community members through this amazing network of organizations that we have, 45 plus community organizations and grassroots networks, and developing 65 plus creative community-led communications, which we are very, happy about and proud of because that work has constantly been sort of recognized in the industry for creative excellence, advancing standards, from peer society to Communicate Awards. Just last night, we were announced as one of the winners for Communicate Awards in 2026 for our work with the NIHR Bioresource and a music video with Alador. So, yeah, just sort of reflecting on everything that we've achieved over the past 6 years and how we've been able to sort of share that amazing success with our community partners. And yeah, I just wanted to mark that as our sixth anniversary. And now I'd like to hand over to Annette.
Thank you, Bhuvan. And hi, everyone. Thank you so much for joining today. Please bear with me a little. I have a little sore throat, but hopefully we'll power through the next hour. I just want to set a little bit of context before we move into the panel discussion about why we felt it was really important to have this discussion today. Thinking back to when Egality was founded in 2020, I'm sure you will believe that the pace and change of AI from 2020 to 26 now has just been mind-blowing. That progress in fair representation in research and in health equity has sadly not gained so much momentum. We all know that if certain groups are not represented in clinical trials or research, then the medicines or interventions that are developed may not be as safe or as effective for those who are not included. And we also know that trials are more effective and inclusive if they are designed with the people they are tending to serve, particularly those who have been underrepresented and underserved by research in the past. What we're hearing and seeing at the moment is that AI tools are being integrated into trials and research at great pace, but these tools are being trained on data and research that does not fairly represent women, people of colour, and other groups that have been marginalised by society. And so those tools are not optimised for those people and can also actively exclude them from research. We're also hearing that people are now using AI in place of getting human insights and thinking that they can use AI to understand what people and communities are thinking and base their research off that. We went out ahead of this to our community partners and sort of asked them what they were thinking and feeling about AI at the moment. And, while they can see that real opportunity, there's also a real fear that AI is just going to perpetuate the injustices that already exist in our inequitable health system and in society. And so we felt like now was a really important time to pause and have a conversation about where AI has opportunity to really leverage inclusion in research and equity in health, but also where there are real risks. And that is why we've brought together our fantastic panel today with expertise ranging across the pharmaceutical sector, community advocacy, patient engagement, and AI and health tech outside of the health sector. We're going to have a sort of 45-minute discussion, and then we'll also be opening up for questions. But to the audience, please do comment, ask questions in the chat. The team are monitoring that and we'll be able to pull through those questions at the end if you have them for the panelists or sort of have points to make as well. So please keep that active during the conversation. I am going to first kick off by asking our panelists to introduce themselves, and then we'll be kicking off with a few different questions and getting things started. So everyone happy to crack on? Looking around the room, everyone seems ready to go. Brilliant. So I'm just going to hand around the room to introductions, quick name, role, organisation, and Shuli, I'm going to hand to you first.
Brilliant. Thank you so much. Delighted to be here and happy birthday. My name's Shuli Porkes. I'm a co-founder at PM Life Sciences, where we help biotechs with developing their medicines and the policy around that. I also work with Nick Broughton at Ethos on AI ethics, and I'll be sharing some of that framework that we've been thinking about with the ethical use for AI. And I do a number of other different roles, but yeah, really looking forward to the discussion. Thank you.
Thank you, Shuli. Farah, over to you.
Thanks, Annette. So excited to be here. And again, happy birthday to Egality. It was incredible to see all of the work and the impact that you've had over the last 6 years. So congratulations. My name is Farah, and I am a co-founder of an organization called UNEMCO. We're based in Canada, and we are a patient engagement and advocacy studio. We help pharma, life science, as well as patient organizations connect with the patients that they are building solutions with and for, and really help to bring that lived experience to the center of those solutions.
Amazing. Thank you, Farah. Neelam, over to you.
Vaiguru Ka Khalsa, Vaiguru Ki Fateh. So my name is Neelam Hirashagil. My pronouns are they and she. I run an organization called Sisters, which is around menstrual maternal healthcare inequalities and really reducing those inequalities within the community. So I have the community hat and building community from the ground up. But on the other side, me and my husband are building a health tech organization around postpartum care and how health tech can sort of support that journey too, based on my lived experience. So again, building that community lived experience through the journey of health tech as well.
Amazing. Thank you, Neelam. And Shen, over to you.
Hi, Annette. Yeah, I'm just gonna repeat what everyone said and greet you. Happy 6th birthday. That's amazing. Also, what an incredible room of women. Like, I feel a little bit insecure with all of your achievements. But my name is Shen. I am the founder of Launch Lemonade, and think of us as the Canva for AI agents, but our priority is making it secure and safe for businesses to use. We also do AI training. But the mission of Launch Lemonade is really to allow teams and individuals and experts to take equity in this crazy technology that's changing everyone's lives. The number one question that I have is, how can we make this for everyone? And thanks for having me here.
Oh, amazing. Thank you, Shen. And without further ado, we'll get started with discussion. So we know there are a lot of sort of risks and fear around AI at the moment, but there is also some great work happening and some positive movements happening in this space. So I'm just going to ask each of the panelists to talk to us a bit about some positive work that they've seen in this space. And Shuli, if it's okay, I'll start with you again.
Yeah, delighted to. So, the question of what's working, is AI working in clinical trials? Given my background, I was like, okay, let's look at the literature and have a look at. So last time I looked at the literature, it's quite limited. So I went, okay, let's see what's happened in the last few months. And I found this amazing review. The title, just reading it, Artificial Intelligence in Clinical Trials, a comprehensive review of opportunities, challenges, and future directions. 212 references, seemed perfect. Some nice numbers. Please don't write these down, and I'll tell you why in a second. So improved enrollment rates by 65%, 85% accuracy in forecasting trial outcomes, AI accelerated timelines by 30 to 50%, reducing costs for 40%. I started to read it and I went, hang on, I don't really understand what they've done here. Started to delve into the references and they weren't there. And actually, it just didn't make sense. So I use my AI, I use Perplexity Enterprise, use the Claude within it to analyze it. And, they said basically its references were probably fabricated, the ones that I couldn't find, duplicated, lack of transparency on methodology, probably used AI to write the paper, which isn't a bad thing, but didn't declare it, and rounded number sizes. And that paper's now been cited by 19 others. So the answer is, I don't know. But to your point, Annette, what gives me hope is this lovely example that I've talked about before, which is a paper by Krishnan et al. On antibiotic design from 2025. And what they did was they basically developed 2 AI models to look at how you could create new compounds that could be tested to see whether they could be developed into antibiotics. Between the 2 models, they generated, and we know we've got an antibiotic problem, right, with antibiotic resistance. So between them, the models generated over 36 million potential compounds. They managed to actually physically make 24 of those compounds. 7 were found to be antibacterial, and 2 were a new mode of action. And those are now kind of in early development, and hopefully both of them will make it through. And that gives me a lot of hope, a great example, but a lot of hope, because actually the authors said that what they found by doing that was that antibacterial space is really underexplored, and using their sort of method could help us find antibiotics of the future, which is so important. So is it helping? Yes. Can I give you some information? No, or clinical trials, I just don't know. But I'd love to see more examples published of that. But I think, the thing that's made this particular one work was being very clear on the use case. The authors were really clear on, we're going to do a model to answer this specific question, and then we will test the outcomes. Thank you.
Amazing. Thank you, Shuli. And yeah, agree. There's such potential for AI in areas like AMR, these health challenges we've had for years. But there's also that scary aspect that some elements of work with AI are just being cited and taken forward without the depth of research behind it. So definitely 2 sides to the coin there. Thank you for sharing. And Farah, if I could hand to you next with the good practice you're seeing in this space.
Sure, thank you. And Julie, I find it fascinating what you just shared. I think when it comes to patient engagement and the work that we've been doing to help organizations embed lived experiences into their work, AI can be really valuable when it comes to understanding data at scale, right? When we're looking at digital listening, for example, and we've helped our clients build digital listening tools to really, gather those insights and try to make sense of them. I think where we still need to be a little bit cautious about how we use AIs when it comes to the trust conversation, the trust conversation around building relationships with communities, with patient communities, especially those that haven't historically had a voice, or who haven't been represented. I think those kinds of problems and challenges really need to start with that human connection and that human understanding. And that's how we can make progress when it comes to understanding the experiences of humans. It's really with that trust, and that starts with that human interaction. So I think that there's absolutely value when it comes to using AI tools. And from a clinical trial perspective, things like portals and matching patient experiences against criteria for trials. Like, there's so many positive use cases, but I think the one that I would really still hold as something that needs to start with people first is when it comes to that community building and trust.
Thank you, Barry. Yeah, absolutely agree. Again, huge potential in that digital listening space and the amount of data and information we can gather now, but we just can't lose that human first element, and you can't have those meaningful conversations without building the trust first. That sort of really resonates.
And I think, and that, there have been so many instances where people have been skeptical to engage from a health perspective with life sciences, with pharma companies, because of a lack of trust. And now, if we're replacing that with AI, I think we're actually making that divide even larger than it was before.
Absolutely agree. And I think I'm sure that Neelam will have some points that just bounce off that really nicely as well. So I'm going to hand you, Neelam, to also talk about what you're seeing in this space.
Yeah, so obviously I come from a very different angle, and we spoke about trust just then. But I don't think we can replace trusted relationships through AI. Relationships are consistency, it's lived experience, it's real conversations, and AI sort of replaces that element. So if we look at things like for a postpartum journey, for example, postpartum journeys we know in the UK are quite difficult. We know that the maternity system is quite difficult in the UK. The recent report has just showcased a lot of that. So already, if we look from a healthcare perspective, people are already feeling not heard, not seen, not human. Statistics. AI seeks to almost cover that up and not have a real conversation. So if already you're feeling unheard, you're going to feel that worse because you're not talking to people. And I think when we look at community engagement, patient engagement, it's not just about collecting data. It's really about power sharing, which AI can't do. And I think that's really interesting in the context of this conversation, because community should be shaping how, research is done or how the apps are created. And that isn't often done because AI is only as good as the data it's trained on. And we know that the data that it's trained on isn't often the most marginalized people. If it's the most marginalized people, then the data is going to reflect those groups, which it often doesn't. And I think when we have like human conversations, real like one-to-one conversations, even, outside of Zoom, for example, it picks up different nuances that AI will miss. And I think we have to, we can hold those truths up. We can say on one hand that yes, AI does a lot of great and streamlined things, but it has the potential of missing out more marginalized groups. And ineffective, that healthcare inequality that we're seeing in marginalized groups, for me, is only going to get bigger in certain demographics if we don't acknowledge that as part of our work. So that's the sort of thing that I see quite often. And I'll give you an example of where we've seen that in practice. So in maternity services, we have the pulse oximeters. So it registers the oxygen levels of people with darker skins. Now, when Black women and Black patients actually were just going around, it was around COVID-19 time, so it's quite a few years ago. But when they were looking at the oxygen levels, because they had darker skin tones, it wasn't picking up that oxygen level properly because it was never tested on Black skin. So if AI is using data like that, we're never going to quite get it right. And so these things can really reinforce inequalities rather than actually correcting them. So I know there's lots of campaigns now around getting things like different skin tones, looking at rashes from different skin perspectives. But I think those things are really important to recognize when we're talking about AI and how it can streamline things, because actually it's got a potential, a really big potential of missing things out as well.
Absolutely agree, Neelam. And I think hearing loud and clear from both you and Farah about how important that trust building, that community relationship building is, and how it just can't be replaced by AI, alongside then the data issue, and that these tools are being trained on biased data as well. Really important points. And I hope as well there is some elements where we can see AI having a positive impact potentially in health inequities and addressing the inequalities that we see. I just want to hand to Shen to talk a bit about what she's seeing outside of the health sector, any positive examples you can bring from other areas.
Absolutely. Thank you. I have been delivering AI solutions for the past decade, predominantly before my startup, predominantly in finance and financial services, specifically catching bad actors or fraudulent actors. And before ChatGPT, models have already sped up the ability for companies to catch bad actors so that bad actors don't take over your financial accounts. AI solutions have been effective there. Now, when we talked about discrimination and bias before, we called it false positives. False positives has always been around. Like, we've always discriminated or made wrong decisions about certain demographics. And you know that we can talk about the impact of AI as well for fraudsters, but it has been impactful from that perspective. And you know, like for me as a business and the many businesses that I've worked with, as a second positive, I've freed up my time so much that I'm talking to more people than ever. Like, I'm in rooms like these more than ever. And I'm less in front of screens because of AI and automation. So yeah, those are the two positive things that I'm seeing outside of health.
That's a really good point, Shin, and I agree. In some areas, AI is taking away a need for some of that administration work, and can we use that in a positive way to then go out and have more of those conversations and build those relationships and trust that we're hearing is so important as well. And I thank you for bringing that to the table, and thank you all for your examples. I'd like now to just sort of delve back in, and Neelam, I'd be really interested in your perspective, just in your role as a community leader and advocate, sort of what you're hearing from the members and the networks that you're working with at the moment around their perspectives on AI and the positive or potentially negatives it's having in the area of health research.
So we've done some really interesting work on menopause apps and AI, there's a lot of menopause apps out there, and what they want to do next is like 2.0, getting AI to help that sort of journey a little bit faster, help with that, putting symptoms in, all that sort of stuff. So when we did a few focus groups, particularly with South Asian women, and said, what do you think of this 2.0? The feedback that we got was, oh, we don't really like this because we don't really understand it, and it's a little bit scary. It sort of delved into also using a lot of other technology like smart watches, which a lot of the Asian women that we spoke to, I'd say about 90% of them, they were like, well, we don't want to wear these watches. We don't want these extra trackers. We just want to find out what's wrong with us and get to a solution. And that's the crux of the issue, isn't it? If we're looking at menopause like that particular project, all they want is the right medication, HRT, figuring out if there's any holistic things that can help them with that journey. But AI isn't going to really help them with that. That is actually a conversation they need with their doctors, particularly those ones that have other conditions as well. So a lot of the conversations we had is a real fear around, well, is this going to replace conversations with the doctor? A lot of the women that we spoke to don't actually have English as a first language. So when they were writing things into the app as part of the testing phase, the way that things are worded, the way that South Asian women talk about menopause is very different to a white woman because we have these cultural nuances. So they weren't actually getting the same results for the exact same thing purely on the way they worded it. Because again, it's not used to sort of those nuances of different languages or people's phrasing things from a cultural lens. So I think there's a lot of promise in it, but I think there's a lot of work to be done around actually talking to communities about what is health tech, because actually it's not just AI, it's what is health tech. It just sounds big and scary and it sounds very removed from communities because a lot of obviously the communities we work with, digital poverty is a thing as well. So they're very far removed from this conversation. So when you suddenly start talking to them about AI, they're a bit like, what is it? What's it doing? Where's that data going? Who's going to take it? And is Auntie Shabnam down the road going to find out about my data? Because is it going to get leaked somewhere? Because I read in a WhatsApp group that you're going to steal my data and something's going to happen. And these conversations, whilst, we might have a bit of a laugh about it, are real fears to the community. So I think we have to take a very grassroots, bottom level up approach if we want to bring people on that journey with us. And that's what it is for us at Sisters, is really about bringing people on that journey with us, because innovation is great, but innovation without community isn't really innovation. It really feels like it continues to exemplify sort of the injustice that we're seeing in healthcare. And I really think that we definitely will do better bringing people along with us. We raise the bar for everybody if we invite the most marginalized person into a room. So I think that's the way to go.
Absolutely, strongly agree, Neelam. And yeah, it feels like a lot of people are sort of like, AI technology will solve everything. We can give it to everyone, and it's not actually what people want or need. A lot of it's around that holistic care or designing those interventions with them so it meets their needs. And I think that's a really important message we need to take through into this conversation. And obviously, with using AI and sort of like health tech, health equity spaces, we're coming up against a lot of these ethical challenges, and that's something we really need to sort of hold ourselves to account to and think about. And surely you're doing a lot of work in this space. So I'd just like to hand to you in terms of what you're seeing from that sort of ethical framework perspective.
Yeah, so we're building a practical ethical framework to help people, and I'll give two sort of levels of comments, one a general perspective and then a very specific bit on the health equity. And so from conversations with people in sort of fora like this, sort of in the UK, been speaking over to the US to speak there. And I think there are two kind of key gaps. And I would say this isn't actually about the AI, it's about humans. And if you just hold on to that thought, and I'll explain that a little bit more. So first gap is humans being able to engage with AI at all. And right now I'm thinking of like us in our professional setting, so within this sort of room. So people are, there's a lot of technical jargon, there's lack of the vendors and developers, and then people working in trials actually being able to have a meaningful conversation together because they're sort of speaking different languages, and how that, then it's impossible to then say, so how could this fit into the process? And then we're seeing, and I've got some data on this which shows that people are kind of either blindly accepting AI, going, this is great, it'll do this, or outright rejecting it. And so it's about helping people to feel confident to engage and question based on their existing knowledge. They don't need to be a data scientist or a software engineer. They're experts in clinical research or experts in community engagement or whatever their expertise is. And so that but it does require people to be aware of some of the key characteristics of AI beyond the technology. So we talk about hallucinations or sycophancy or terms like this. And I think there is something about helping people to understand those concepts, but not having to get into the real detail. And then secondly, it's then that critical thinking about whether AI is right for that situation. And this is where the ethics comes in. So you need to think about ethics, you need to understand some human characteristics such as bias. So it's human bias that impacts the training data, it's human bias that impacts the algorithms, and it's human bias impacting what we do with the AI outputs. And on the health equity side, Annette, you and I've worked together on this with another of my roles at the Faculty of Pharmaceutical Medicine, and we pulled out some key areas in the piece of work we did around, and two I want to draw on are the need to improve data collection in clinical trials to support diversity, and the need to build trust with the community. So that piece of work was done not thinking about AI, but actually those two themes then come directly into this conversation about how do we collect data in the right way and the right data, so that then we can do trials in the right way. And the trust bit, we've obviously got absolute experts here on the panel to talk about that as well. So I think that means that organisations involved in clinical trials must use think and use their AI through an ethical lens, even more importantly. And in our work we talk about 6 emergent risks from this human AI interaction. So unacceptable bias, overdependence on AI, accountability loss, and some others. And then we apply a series of questions to pull out those ethical issues. And the questions center around: what's the benefit you're trying to do here? What are the harms that could happen, and how do you minimize those? What's the impact on individuals' autonomy? So I think that comes back to the power sharing, the power sharing question, and the question of fairness, and that's based on a medical ethics model. So we're building this practical framework, and that will be released soon to help people understand the risks. And it's really turning that into practical questions, because I think people are going, oh, I've got this potential AI that I've heard other people use, or my company and organization has released AI onto me and told me I have to use it. And I saw there was a question in the chat, or a comment in the chat, about is it generative or other types of AI. I think the ethical principles apply to all of the types of AI, to really sort of say, okay, how do you turn those principles into something practical, so that people can look at it and go, yeah, I can ask these sets of questions and decide whether it's the right AI to use for this right situation. Thanks, Annette.
Amazing. Thank you, Shuli. I completely agree. This is about, human autonomy and bringing that critical thinking. It's not AI that's necessarily unethical. It's the people that are using it and how we use it. And it's great to hear like people that you were thinking about practical frameworks that can help individuals think that through. Because I know myself coming through trying to navigate this, it's such a minefield. So the practical kind of framework support is exactly what we need in the system at the moment. And yeah, really glad to hear that work is happening. I'm just going to hand over to Farah now, who's going to really be interested to see, Farah, from your experience in the patient engagement space, sort of how that's been changing, and sort of where you're seeing AI having a role and where it's having an impact. And then after that, I'll just be tapping in with Shen again to get her reflections sort of what she's heard from a perspective outside of the health system as well. Over to you, Farah.
Sure. Thanks, Annette. And Shuli, I appreciate what you're saying from an ethical perspective, because again, I think, what is the question and the problem we're trying to solve? And I think the more clear and specific we can get on that, then we can understand, where is there opportunity for AI tools to support and amplify this work, and what pieces of this require that human-centered relationship. And I think, where AI is, I think from a patient engagement perspective, let me start there, is that for a long time, for almost my career, we've been talking about, the problem being that patients aren't consulted, right? That patient input is really the problem, that we're not hearing from people, that patients are being asked. But I do think that we're actually seeing patients being asked a lot across a lot of different mechanisms and forums and opportunities. And so I think sometimes what's happening, and this is where I think AI has the potential to really help, is help us retain that memory better. Because sometimes when we ask patients for their input through surveys, through conversations, through focus groups, through online forums, those insights have sat historically in slide decks, in insights reports that were often not surfacing after that one engagement. And so that's where I think there's also real potential for AI to help us with that memory, and that can actually help build trust, because if we're able to acknowledge, recognize that we've had conversations with these patients before. We've solicited input from patient communities before, and now we're going back a second time, a third time. But AI can really help us with that memory, and then being able to reinforce the fact that we've had those engagements before. It can hold that and carry it forward so that communities don't think, we already shared this, where we already provided these insights, and now you're asking for them again. And I think that that's where there has been historically frustration with patient communities who feel like we're being asked again for this thing, for this input, where we already did this years ago. Sorry. So I think that that's where there's opportunity, absolutely, to really use AI tools. Again, not AI as strategy, but AI tools in the right ways to answer and those specific questions.
Thank you, Farah. Yeah, I think that's a really interesting point about how we could use it as a better memory for the work that's been done. I'm sure, and Neelam would attest to this, that community organisations that, like yourself, often get asked again and again the same questions because researchers aren't sharing their information or talking to each other or keeping that collective memory together. Shen, I'd just like to hand to you now before we get to our final question. So, Shen, just really interested in your reflections from what you've heard from a perspective outside of the health sector.
Yeah, I think, I think the reason why fintech as an industry has been able to disrupt this legacy of like banking is because of the speed that they've been able to deliver a service, whether it's issuing a credit or helping business owners and individuals get a bank account. Because if you remember in the old days, you have to line up to a bank and wait for weeks to open up a bank account. But these neobanks, the new banks, they're able to give you a bank account quickly. And speed was a solution. And I think and this is why they've been able to succeed as an industry. And I think this is also like reflecting on within the health space is the biggest opportunities that more people can get served quicker. But how do we do it right that it doesn't discriminate and it's able to serve everyone instead of just a few?
Absolutely. I think where there's opportunity for momentum and progress, and we can get those tools that will offer opportunity to serve all, we need to get that energy behind those so that we can really drive those improvements in health equity that we're sort of joined around seeing. Oh, brilliant. Thank you, everyone. These reflections have just been so interesting. And before we open up to questions from the audience, I'd just like you all to leave us with one thing or a few things that you'd like the audience to take forward and commit to, if they're thinking about using AI in their work, whether that be sort of research or community or patient engagement, any commitments, principles, tools that they can take away practically from this to think about taking into their everyday work and their everyday lives. Yeah, Julie, if it's okay, I'll kick off with you again.
Yeah. So I think, we all know we work in a really, really important area, and we are responsible for the ethical practice of that, and whether it's in trials engagement, the intersection, and you can't delegate that ethics and judgment to AI. So I would say everyone on this call is an expert in what they do. So my request to everyone was, be empowered and equip yourself with the knowledge and tools you need to apply that ethical thinking. You've got the, content, the subject matter expertise, domain expertise, whatever, however you describe your expertise, you've got that expertise. So then, feel empowered and get yourself upskilled with around the ethics of it and apply that ethical thinking, because you can't delegate that to the AI.
Thank you, Julie. I love that. And yeah, I can sometimes feel that AI is stealing that element of expertise we all have, but everyone is still experts in their own field and can feel empowered to bring the ethical thinking to their work. So thank you. Farah, you next.
Yeah, I think it's about understanding, am I using AI for the sake of AI, for the sake of using a tool, or am I really, using it to help achieve a specific goal or objective? And I think that that's a really important question. And then maybe I'll just add one more is that, are we when we think about patient engagement is around, who are we excluding from this? Are there communities, are there patients, are there perspectives and experiences that we are excluding through this? And have those conversations. I think that that's the most important thing when we think about this work in patient engagement.
Thank you, Farah. I agree. That's just two really important questions people can ask themselves. Like, am I just using AI for the sake of it? And if I am using AI, who could be excluded from this? So thank you. That's two things I'm definitely going to keep in my head as I go into work next week. Shen, over to you.
Thank you. Because I come from a different perspective, I think that the most important thing this room needs to almost really understand and live with is how do we make sure as women, because most of us are women here and the panels are all women, do not get left behind in this whole thing. So there's different ways of thinking about discrimination and equality and making sure that we have a view of understanding what is ethical and what is equal. But for me, my biggest kind of like mission and what I'm really passionate about is how do we make sure that we take equity from this and not just conglomerates and men? Because historically in technology, most of the rich people who've been able to take equity and the potential of what we can take are unfortunately white men. If you look at, I don't know if you saw the Time magazine cover, I think it was last week about will these 5 men do something about AI? And it was Sam Altman, Amadei, Microsoft, Google, all of these CEOs. They're all men. But what about us? Like, how can we make sure that we're going to be making money from this, future-proofing our livelihoods, and building businesses that take advantage of this technology? That's what I'm very passionate about. So yeah.
Amazing. Thank you, Shen. Love that as well. I completely agree. This new AI power should be shared equitably across people and across societies so that we can all benefit, not held in the hands of the few. So yeah, love that. Thank you. And Neelam, over to you.
So I guess from a real community perspective, a lot of our work, a lot of everything that we want to do here is actually including marginalized people, but we want justice for those communities too. And we've got a real opportunity here of doing that together. So for me, co-designing that work before you actually start coding is a big one. So get people in through the door straight away. Testing for equity, not just access or accuracy. Let's test for that equity place as well. If it's poor outcomes for Black, disabled, LGBT communities, all of that, then it's not ready to be like promised to the millions. Funding community engagement should be a core part of that work. And that's something that we often see at Sisters is, oh, can you help us? Can you just review this app for us? We'll give you a £20 gift voucher. And I'm like, no, why would you give me a £20 gift voucher to go through all of your stuff to give me a tick box? No, like let's fund this work properly because I really believe a lot of the solutions are in the community itself. So the problems we see in the community can be solved by the community. They just need resourcing, the tools to be able to solve them with you. For me at Sisters, this is an olive branch to say, let's do this work together instead of happening to us right at the last hurdle. And let's be transparent about data rather than waiting for someone to tell us what's going to happen with this data. Let's tell people this is what we've got. This is what the data is. Even if it sounds really simple to us, we need to tell communities because there is a distrust, there is a fear. We don't want anti-Shabnam down the road to have our data, and we want to know how are you going to protect that? And let's start measuring what we're missing in the work that we've already done. So don't start just reporting that we've done all these great things. Let's see who wasn't part of that conversation. Who do we need in these rooms with us? Let's bring those people on that journey. And if they weren't in that journey, let's try to find out why. And let's work with the people who are already there doing that work in the community. So we've got real opportunities here. And I think if we work together collaboratively from the beginning, AI's got a real potential of supporting communities. And I'm really excited to be part of that journey if anybody wants to join us.
Amazing. Thank you, Neelam. A fabulous one to end on. And I just want to say thank you again to all our panelists for the insights that you shared and sort of those rousing statements at the end that have also given everyone something really practical to take away and think about. We've got about 12 minutes left. So I'm just going to look to my team who have been monitoring the chat and just see if any questions have come through for the panel. Bear with us one sec where we do some behind the scenes. Okay, we've got nothing in the chat, so I'm going to open it up to the audience. If you have any questions for the panel, if you could raise your hand, we'd love to hear from you and sort of get your thoughts and perspectives on this, or if you've got any direct questions for anyone around the room as well. Don't be shy, it's a Friday.
Yes. Any questions?
Hi, can you hear me?
Yes.
I did put it in the chat. Do, as an expert, I hear everything you say, and I'm totally with you. I've observed problems when they've tried to integrate AI into country healthcare systems, and I had an experience this week where it went horribly wrong. Is there advice that, or your thoughts on how we can approach government and policy about how to do this so that it actually helps patients rather than making it an absolute hellhole? Excuse my French.
Oh, thank you, Faye. Firstly, sorry to hear that you've had that poor experience, but thank you for sharing and raising an important question about that sort of advocacy to government piece. Really interested in the panelists. If you want to respond, just pop off mute.
Yeah, I can share some initial thoughts. I'm not sure if it's a solution, but it's a thought of that. I think one of the big themes, whether it's an experience like you've had, which I was really sorry to hear about, or actually just in use with AI in general in kind of working life, of if it's not working, then giving that feedback and not just accepting. So the kind of the general thought is we need to be able to collect experiences. The bit where I haven't got the solution is then how do you do that in a way that doesn't place burden back onto someone who's unwell or someone who's just gone through an experience, and it's not about making it their task to give the feedback. And that's the bit where I don't have the solution, but that we need to as a system we need to be capturing where is this not working, and actually as a system we should also be doing even a step more proactive than that, and actually testing to say, does it work? Where does it fall down? What doesn't work? Does it work for everybody? So yeah,
that's what I suspect might well be missing, because I have a long career in drug development and marketing, and I'm like, I know that in isolating candidates for clinical development, AI does wonders. But then when I look from a patient engagement angle, I'm like, oh, this really isn't cutting it when you need the human touch. So I have really, really mixed feelings about AI, because I'm like, we're asking it to do too much. We know there are problems. And at the end of the day, patients are people. They want to speak to other people. When that first call someone makes, if they're considering being part of a clinical trial, they don't want to talk to AI. They need someone there to talk about the real stuff, like how is this really going to affect you, and to be honest and transparent. And I come from both industry and patient background, so I see all sides of it. And oh wow, I see so much going wrong, but I also see so much future if we implemented things better. Sorry,
Thank you.
that's my piece. I apologize.
No, absolutely. Thank you, Faye, for sharing and sort of very much agree with your sentiments there. And I can see the panel nodding along. I just wanted to see if any of you wanted to just sort of respond to Faye's last points there, particularly around that patient engagement piece not being done quite well. Farah and Neelam.
Yeah, I mean, I think this, this at the systemic level, it's really challenging because I think so many assumptions are built into systems around, where information is going, who it's going to. I mean, I think from a patient advocacy level, Faye, it sounds like you're doing all the right things, and your background is clearly so valuable when it comes to navigating your own healthcare journeys. I really think that, you know, in many countries, in many systems, we as patients, we feel like the system is connecting the dots for us. The system is making things happen. And I think the reality is that as a patient, you have to connect the dots, and you really have to be the person who is double checking, asking the questions, unfortunately, sometimes sounding like you're repeating yourself, you're asking the same things to the same people. But I think that, a lot of times these things fall through the cracks, or there just is no person on the other end of that system or that process. And so, I do think, unfortunately, a lot of the onus is on the individual patients. And that is really challenging for so many reasons that Neelam shared. That I think many of us have experienced as women of color. But I do think that I know that's not like the best answer to this, but I do think that when it comes to advocacy, like, you have to be your own best health advocate.
You're on mute.
Classic. It was going to happen at some point during this panel, but I was saying I very much agree, Farah. And I just I can see both Laura and Fran have their hands up. So Laura, if I can go to you first for your question.
Hi, everybody. Thank you so far. Such a great discussion and a really amazing panel. So I am a researcher, and my sort of area is health psychology. So I do a lot of work with patients and the public around health conditions and health behaviour change. And I'm an expert in qualitative research, where there is a real push at the moment to try and kind of get this messy, long-winded process just done really, really quickly. And I've been doing quite a lot of work with a sort of special interest group looking at, can we do that? Should we do that? Like, if and when, and trying to work that out. And one of the things that our group is interested in and think that there's a kind of knowledge gap about is, what do underserved, marginalized patients and public actually understand by AI about what would be going on with their data? What do they need to know to be able to even consent to this happening? I just wondered what insights you've got from the panel's work with people, and particularly, I was thinking about the example that you brought up earlier about, actually we should be able to dip back into what we've already got. We should be able to synthesize all these insights that are kind of stuck in file drawers somewhere. We should be able to kind of leverage that. So just wondering how that fits with the understanding, consent, and acceptability of these sorts of approaches. Don't know if you've got anything that you've looked at so far, but really interested to hear.
Thank you, Laura. Really important question around sort of what knowledge communities and people need to have to be able to consent and take part in sort of qualitative research in other areas. Looking to the panelists, Neelam, is this one you'd be interested in taking?
So I think because there is so much distrust, it goes back to what I've said. They need to understand what AI health tech actually is first. A lot of times when people have come to us to get support on on their app or their research project relating to health tech and AI is very at the last stages. So they have no idea what's been happening for the last couple of years on these projects, because obviously they take some time to get to fruition. So they're being asked for like a 1 hour consultation for like a voucher to say that this is a good thing to do or a bad thing. And actually, what they need is to really understand the journey of how an app is created or how this health tech is created, because they're not privy to any of that. They don't know anything. So from my sort of journey with the ones that we've done on the Change Extra app, because they were co-produced from the very beginning, the people that would not want to, use an app before, didn't want to use any smart technology, for example, like the watches, because they were taken on that journey of what it actually is, how it might benefit them, how it might hinder them, having those honest conversations as well. I think probably about like 7 out of the 10 that we had as part of that co-produced group probably actually use that app now, but they never did right at the beginning. And that was purely because from the very beginning of that being, before it was even coded, they were approached with, I've got this idea. What do you think? Can we build this together? And that's where it's really important for people to have that journey. So I believe all communities need to know everything about things before. You can't give them piecemeal bits of information and expect them to make an informed decision. And I think it needs to be everything. So I hope that kind of answers everything, Laura. And I also know that's a lot of work for researchers and people building this tech, but that's the only way to make this work ethical and actually fair and just for communities, particularly communities of color, who have been, historically subjugated around things like bodily autonomy and health and things. And I honestly feel if you want to see a just healthcare system, it needs people, patients involved from the very beginning.
Thank you. Yeah, early and meaningful while it's still actually got chance to change and be what it needs to be. Thank you.
Brilliant. Thank you, everyone. We are at time, so Fran, I'm so sorry, but if you want to email us your question, we can share that with the panelists and get back to you with responses. I just don't want to keep everyone any longer than 1 o'clock. I know it's Friday lunchtime now, and I just want to say a massive thank you to the panelists again and for all of you to attending. I just want to remind you of the panelists' last words. So feel empowered in your expertise to take that critical thinking to AI. Ask the question whether it's necessary and who's being excluded. Put communities at the heart and bring them along the journey. And let's make sure the benefits of AI sit with everyone and not just the few. So thank you so much, everyone, for today. And lovely to see you all. Thank you. Have a great rest of your Friday.